If you take your vitamins right before bed, thinking you're doing your body a favor, there's a good chance you're working against yourself. Not with all of them, just a few. And the strange part is, the vitamins most likely to be sabotaging your sleep after 60 are the same ones people reach for specifically because they think they're healthy. A B complex, a vitamin C tablet, a calcium supplement, because someone told you it protects your bones. Here's what almost nobody tells you. One of those, taken at the wrong hour, can quietly cancel out the exact mineral you're taking to help you sleep in the first place. Tonight, before you swallow that last handful of pills, I want you to understand what's actually happening inside your body after you take them. Because for a lot of people over 60, the vitamin routine isn't neutral. It's working against the sleep you're trying to protect. Let's start with why this matters more after 60 than it did at 40. Your body's relationship with nutrients changes as you age, and it changes in ways that are easy to miss because nothing about it feels dramatic. Stomach acid production declines gradually starting in your 50s and 60s, which changes how efficiently you absorb certain vitamins and minerals. The lower esophageal sphincter, the muscle that keeps stomach acid where it belongs, loses tone with age, which is part of why acid reflux becomes so much more common later in life. Kidney filtration slows down gradually as well, which affects how quickly your body clears excess minerals like calcium. None of this is talked about because none of it shows up on a standard blood panel. Your doctor checks your vitamin D, maybe your B12, and if the numbers are in range, the conversation ends there. But the numbers on a lab report don't tell you when you took the supplement, what you took it with, or what else was competing for absorption at the same time. Timing is the variable nobody measures, and it turns out timing is doing a lot of the work. This isn't a niche concern either. In one large national nutrition survey, more than half of adults over 60 in the United States reported taking a multivitamin or supplement regularly, and a significant portion said they took their full daily dose in the evening, often because it's the easiest time to remember, right before brushing their teeth. That habit, formed for the sake of convenience, is the exact habit we need to look at closely, because a handful of very common ingredients behave completely differently depending on when you take them. Root cause number 1. B vitamins, especially B12, B6, and folate, taken as part of an evening multivitamin or B complex. Here's the mechanism, and it's not complicated once you see it. B vitamins are essential cofactors, meaning your body cannot complete certain chemical reactions without them. In the synthesis of catecholamines, that includes dopamine and norepinephrine, two of the primary neurotransmitters your brain uses to create alertness, focus, and motivation. This is basic, well-established biochemistry, not a fringe theory. During the day, that's exactly what you want. At 9 p.m., an hour before bed, it can work directly against you. Think of it like this. Your nervous system is trying to downshift for the night, and a B complex is quietly handing it a stack of raw materials to build more go signals. For some people, this has almost no noticeable effect, but a meaningful subset of adults and clinicians who specialize in sleep medicine report this constantly in their own patient populations, describe a very specific pattern. They take their vitamins at night to be consistent, and they notice their mind is unusually active at bedtime, or they wake up between 2 and 4 a.m. and can't fall back asleep. They rarely connect it to the supplement because a vitamin doesn't feel like a stimulant the way coffee does. But B12 and B6 in particular are involved in producing the exact chemistry that keeps you sharp and alert, which is precisely why so many energy drinks and pre-workout formulas are loaded with B vitamins in the first place. If a product industry uses B12 specifically because it increases alertness, it's worth asking why we'd take the same nutrient at the one time of day we're trying to do the opposite. There's a second layer to this that's specific to people over 60. As absorption efficiency in the gut declines with age, some clinicians have observed that supplemental doses, which are often formulated at levels far above what your body would get from food, arrive in a more concentrated, less gradual way than nutrients from a meal would. The net effect is the same stimulating signal, just delivered with less buffering than your body is used to. This is why sleep medicine clinicians, when they ask patients about supplement timing at all, consistently recommend moving B complex and multivitamins containing B12 to the morning, ideally with breakfast, where the alertness effect is not just harmless, it's useful. There's a second, quieter sign a lot of people miss: unusually vivid or restless dreaming after starting a new B complex, especially one high in B6. It's not dangerous, but it's a signal worth paying attention to because fragmented dream-heavy sleep is often lighter, more easily disrupted sleep. And if you've ever noticed your urine turning a bright, almost fluorescent yellow shortly after taking a multivitamin, that's riboflavin, or B2, being cleared by your kidneys. A harmless and completely normal sign, but also a reminder of just how quickly and directly these compounds move through your system and start acting on it. If you can see the evidence in the bathroom 20 minutes later, it's reasonable to assume your nervous system felt it too. Root cause number 2, and this one is physical, not neurological: vitamin C and iron, taken on an empty stomach right before lying down. Vitamin C is acidic. Iron, especially in the common ferrous sulfate form found in most drugstore supplements, is notoriously hard on the stomach lining and is one of the most frequently reported causes of supplement-related GI discomfort in clinical literature. Now combine that with something most people don't think about. When you lie flat, gravity stops helping you. During the day, sitting or standing, gravity assists in keeping stomach contents and stomach acid where they belong. The moment you lie down, that assistance disappears. For a 40-year-old with a strong, well-toned lower esophageal sphincter, this might not matter much. But that sphincter loses tone with age, which is a major reason gastroenterologists see rising rates of nighttime reflux in patients over 60, even in people who never had reflux problems when they were younger. Take an acidic vitamin C tablet or an iron supplement on an empty stomach, then lie down 20 minutes later, and you've created close to ideal conditions for nighttime acid reflux. Burning in the chest, a sour taste, a disrupted first few hours of sleep that you may not even fully wake up for, but that fragments your sleep architecture anyway. This matters because sleep quality isn't just about total hours. It's about how much of that time is spent in deep restorative stages versus how much is spent in lighter stages, interrupted by minor arousals. And reflux, even mild reflux you don't consciously remember, is a well-documented cause of exactly that kind of fragmentation in older adults. There's an additional wrinkle with iron specifically. It's one of the most poorly timed nutrients in the average person's routine, because it also competes directly with calcium for absorption, which brings us to the next root cause, and the one that ties this entire video together. And iron has a second, less talked about side effect worth naming plainly: constipation. It's one of the most commonly reported issues with standard ferrous sulfate supplements, and for older adults already dealing with slower gut motility, a nighttime iron dose can mean waking up already uncomfortable before the day has even started. None of this means you should stop taking iron if your doctor has prescribed it for a real diagnosed deficiency. It means the hour you take it and what you take it with changes how much of it actually gets absorbed and how much of it just sits in your gut causing problems. Root cause number 3, and this is the one most people have never heard framed this way: calcium taken at the same time as magnesium at night actively works against the reason you're taking magnesium in the first place. Here's the physiology, and it's genuinely elegant once you understand it. Calcium and magnesium are both what's called divalent cations, and in the small intestine, they compete for some of the same absorption pathways. Take a large calcium dose and a magnesium dose together, and you reduce how much magnesium your body actually absorbs, sometimes substantially. That's the first problem. The second problem is more direct, and it happens at the level of your nervous system rather than your gut. Magnesium works, in part, by blocking a receptor called the NMDA receptor. This is well-established pharmacology, not a supplement industry talking point. Blocking that receptor is calming. It's part of why magnesium is associated with muscle relaxation and easier sleep onset. Calcium does close to the opposite. Calcium is what triggers muscle fibers to contract in the first place, and it plays an activating, rather than calming, role at the neuromuscular level. So when someone takes a big calcium supplement, often 500 to 600 milligrams, taken specifically at night because that's when they remember their bone health pills, right alongside a magnesium supplement meant to help them relax, they're combining a mineral that revs the system up with a mineral trying to slow it down in the same dose, at the same hour, competing for the same absorption sites. It's not that calcium is bad, your bones need it, and after 60, bone density is a real and serious concern, especially for women in the years following menopause. But calcium's job and magnesium's job at night are working in opposite directions. And most people have never been told that stacking them together is quietly self-defeating. There's one more piece of this worth understanding, and it's the reason so many geriatricians are cautious about high-dose calcium supplementation in general, separate from the timing issue. When you take more calcium than your body can absorb and use in a given window, the excess doesn't just disappear. It has to be processed, filtered, and either excreted or, in some cases, deposited elsewhere in the body, including in soft tissue and arterial walls, which is part of an ongoing area of cardiovascular research into supplemental calcium and arterial calcification in older adults. That's a separate conversation from tonight's topic, but it reinforces the same underlying point. More isn't automatically better, and a large single dose taken at the wrong hour asks more of your kidneys and your absorption pathways than smaller, better-timed doses do. Splitting your calcium and moving it away from your magnesium dose isn't just about sleep. It's about giving your body a dose it can actually use, instead of a dose it has to work overtime to clear. So here's the protocol. 4 specific, practical changes, not vague advice to talk to your doctor about vitamins, though you should absolutely loop your physician in on any changes to your regimen. Step 1. Move your B complex or multivitamin containing B12, B6, and folate to the morning, taken with breakfast. This is the single highest impact change in this entire video. If you take a standalone B12 supplement, the same rule applies. Morning with food, not evening. Step 2. Take vitamin C and iron supplements in the morning or early afternoon, always with food, never on an empty stomach right before lying down. If you're taking iron for a diagnosed deficiency, take it at least 2 hours apart from any calcium-containing supplement or dairy product, since calcium blocks iron absorption almost as effectively as it blocks magnesium. Step 3. Move your calcium supplement to midday, ideally with lunch, and separate it from your magnesium dose by at least 3 to 4 hours. If your doctor has you on 1,000 to 1,200 milligrams of calcium daily, split it into 2 smaller doses, roughly 500 to 600 milligrams each, since your body can only absorb so much calcium in a single sitting anyway, regardless of when you take it. Excess unabsorbed calcium doesn't just go to waste, it has to be filtered out, which is extra work for kidneys that are already filtering less efficiently than they did at 40. Step 4. Reserve nighttime, roughly 30 to 60 minutes before bed, for the 2 things that actually belong there. Magnesium, specifically forms like magnesium glycinate or magnesium threonate, which are well tolerated and cross into calming, sleep-supportive roles more effectively than magnesium oxide. And, if your doctor has recommended it, a low-dose melatonin supplement, typically 0.5 milligram to 3 milligrams, taken 30 to 60 minutes before your target bedtime. Nothing else needs to be in that nighttime slot. If your current bedtime routine involves a full handful of pills, the multivitamin, the vitamin C, the calcium, and the magnesium, all swallowed together, you are very likely combining a stimulant, an acid irritant, and a mineral competitor with the one supplement that's actually supposed to help you sleep. One more practical note, because a lot of people over 60 are also managing prescription medications alongside supplements. If you take levothyroxine for thyroid function, it needs to be taken on a completely empty stomach, away from calcium and iron by at least 4 hours, since both minerals significantly blunt its absorption. This is one of the most well-documented supplement medication interactions in clinical pharmacology, and it's a common reason thyroid levels drift, even when the prescription hasn't changed. If you're on a statin, Some research has looked at modest interactions with high-dose calcium and certain B vitamins, which is one more reason to bring your full supplement list, timing included, to your next appointment, rather than assuming your pharmacist and your doctor already know exactly what you're taking and when. Now, 2 mistakes that undo this protocol even when people mean well. The first is doubling up out of guilt. Someone realizes they forgot their morning vitamins, so at night they take both the morning dose and the evening dose together, thinking they're catching up. That's the worst possible version of this mistake. Now you've stacked everything at once, at the exact hour it's most likely to disrupt sleep. If you miss a morning dose, it's genuinely better to skip it for that day than to double up at night. The second mistake is assuming natural means harmless, regardless of timing. A vitamin isn't a sedative, and it isn't a stimulant in the pharmaceutical sense, but it is a biologically active compound, and biologically active compounds behave differently depending on when and with what you take them. Treating your supplement routine as something you can do on autopilot at whatever hour is convenient ignores everything we just walked through about absorption, timing, and how these nutrients interact with each other in your body. Here's the reframe I want you to leave with. This isn't about whether your vitamins are good or bad. Every nutrient we talked about tonight, B12, vitamin C, iron, calcium, magnesium, is something your body genuinely needs, especially after 60. The problem was never the vitamins themselves, it was the hour on the clock. 2 identical pills, taken 12 hours apart, can produce completely different effects on your sleep, your digestion, and how much of that nutrient your body actually keeps. If there's one thing to change after watching this, it's not adding a new supplement to your routine. It's simply moving the ones you already take to the right side of the day. If this opened your eyes to something your doctor hasn't mentioned, hit the like button and subscribe. We cover what doesn't fit in a 10-minute appointment. Visit healthhustleacademy.com. We've put together the exact tools and supplement resources we talk about in these videos. All links are in the description. Take care of your body. Nobody else is going to do it for you.